Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. October is National Depression Awareness Month, and while we'll talk about a little bit about the signs of depression and the best way to deal with it, we'd like to focus tonight's show on happiness and how being happy will actually change your entire outlook on life and have a significant impact in every area of your life. Joining us in this discussion is Express Care's Dr. Jitka Lom. So let's first get the depressing stuff out of the way. But you know, it's a true reality, unfortunately, for some people. So what are the signs of depression and the best ways to treat it?
Okay. Well, depression is a very common mood disorder, and the definition of a major depressive episode in psychiatry is at least 2 weeks of low mood, withdrawn, lack of interest in activities or people that you normally are interested in, and then some physical symptoms such as fatigue, difficulty sleeping or sleeping too much, appetite changes, weight changes, feelings of agitation, or on the other hand, lethargy. And there's a whole list that you can look up. There are so many other symptoms, headaches, stomach aches, all kinds of things that can go along with depression. But the key thing is at least 2 weeks of a very low mood, including thoughts about suicide. And as we're talking about this very important topic, I just want to mention to anybody out there who is thinking of suicide or has family member or friend who they know is considering that option, please get help, because it's a solution. It's a permanent solution to a temporary problem, because things will get better and you need to get help. So putting that one aside, that's the most extreme and severe case of depression, when people cannot get out of their pit, out of their hole, and they consider that option. You need help, and there is help available on Guam. But aside from that, most people don't get to that deep level. Mm-hmm. They're in a low level unhappiness, and that's one of the topics that we'll be talking about. Treating depression, there are definitely pills as a tool for treating depression, and they are very effective. Side effects are usually very minimal, if anything. And so you can use pills to help get you back on track, to change the pattern that people get into of very negative thinking. And that's the key of depression, is that things are spinning around in there, they're negative, 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 and feeling worse and worse and worse physically.
Okay. And so instead of going to pills or medications, there are other ways that you can change your mood. Maybe sometimes just getting a breath of fresh air, or focusing on some gratitudes, which we'll talk about a little bit later. But what are some other ways for people to naturally work to boost their mood?
Let's think about a triangle. There are 3 areas that affect your emotions. One is the physical. One is the focus of your mind, what you're thinking about. And the third part of this triangle is the meaning that you give events in your life. So first, thinking about the physical, how can you make yourself feel better? Sometimes you need some more sleep. Sometimes you need to take a walk, and a 30-minute walk per day has been shown to be as effective in some studies as an antidepressant. Just get outside and take a walk. A third thing that you may need is hydration. You may be dehydrated. And another physical thing that you may need to quit doing is drinking alcohol, because that is a depressant, or taking other drugs. So these are some physical things that you can do. And exercise is a natural mood booster. You can use that to help yourself get into a better frame of mind. So that's the physical. Then you have the focus, what you're focusing your mind on, and you alluded to gratitude. Whatever situation we're in, we can find something in that to be grateful for. Just that you're there in your house watching this TV, you have a couple things to be grateful for. One, you have a TV, you have power, and you have eyes to watch this show. Absolutely. These are things to be grateful for. There are blind people, they cannot see. Okay, so that's one thing, focus. Always find something positive in whatever situation to focus on, and you can find it, or get somebody else to help you find it. The third part of the pyramid is the meaning that we give certain events in our life that make us feel either very sad or very unhappy, or make us feel okay about it. An example would be bills or job loss, or these type of, generally we find them overwhelming and very difficult situations that we might think are very negative. Knowing that down the road, with the perspective of time, we may think about them differently. Relationship loss is another one, right? So tragic when you're heartbroken. A few years down the road, you may think that that was not such a bad thing that happened to you. So being patient and trusting that time will show you that in fact that event had a better meaning for you than you thought at the time is very important. So remember those three things: your focus, your physical self, and the meaning that you give your life events.
Now, I was reading, I was researching on this topic, that circuits in your brain light up when you're happy.
They do.
So being able to change your mood, and you talked a little bit about how to do that, and really having just a more grateful attitude, you know, waking up on a Monday morning saying, oh man, it's Monday, I got to go to work. But for the reality is some people don't have a job.
True
so
story.
to be able to have something.
Absolutely. And when you're talking about the circuits lighting up in your brain, this is shown on PET scans. There are functional MRIs where they put people in MRIs and they show them pictures and make them do different things and make them actually physically change their mood, and they can see that on the scan. Different areas will light up. Or monks meditating, they'll have certain areas in their brain light up that other people that are not meditating will not have. And you can make this happen in yourself. So through the focus, through attitude of gratitude, that will definitely happen. Another way that you can do that is physically. So studies show that if you just sit with a pencil like that, you're making that smile. Or if you're saying "ee," you don't even feel happy, but you're making the "ee" sound. This makes you smile. Okay, just by doing that, you're changing certain chemicals in your brain and you're creating happiness. It
Wow.
sounds very simple, and it is. And it's even more effective if you look in a mirror and you're getting the feedback to your brain of like, oh, I'm smiling even though I don't feel happy. A smile will take you a mile.
So you're kind of tricking yourself.
Tricking.
But eventually it'll change your attitude.
It will.
One last thing I wanted to mention is I've been reading up on this subject for a while, and another thing was it takes 21 days to make a habit. So, you know, maybe focusing on 3 things that you're grateful for every single day. 21 days later, you realize that suddenly you're not looking at things with that negativity, but you're looking at it more positively.
Absolutely. Creating habits of thinking is very important, and we can train ourselves and we can train our children. We don't realize that we're in a habit pattern of thought, and these habit patterns are actually contagious. They're contagious within families and within groups. That's why we have copycat suicides. That's why we have copycat behaviors, especially in teenagers, but also in families, where people pick up on other people's attitudes and on their thought patterns. So we can look very carefully at how we're thinking about something. We can monitor our thoughts, and if we have one that crosses our mind that's perhaps not so helpful to us, we can press delete and wait for the next more positive thought to come through and choose to focus on that one.
All right, good stuff. I look forward to the rest of our conversation on this. We will